I try to start off by letting them tell me what they think their skin type is. A lot of people come in and they say, I'm dry or I'm oily. Those are the two main ones that we get. But I try to ask them questions, of how their skin acts throughout the day. Is it more dry? Is it more flaky? Do they feel like it's more shiny? Do they feel like they see their pores coming about? And try to get them to talk a little bit more about it than just coming in and saying, oh, I feel dry. Because normally what happens is when people feel dry or oily, it's usually not that their skin is dry or oily. There's other stuff going on, whether that be a skin barrier problem, whether that be an internal hydration problem. So trying to kind of target that problem from the inside versus the outside. The summertime is a big changing time. Same with the winter. That tends to be a big changing time. A lot of times sun exposure and the changes in humidity levels tend to make the skin react a little bit differently, whether that be to products or just in general. So people will come in a lot of times either more oily or a lot of times also more dry too with the change of seasons. I would say I see more dryness, but with dryness, it's kind of a catch-22 because a lot of times people come in and their skin feels dry and they feel like they need to load on a lot of moisturizer. But what's actually happening is their skin's actually more oily at baseline, but oil a lot of times presents itself as inflammation, and that inflammation makes you feel dry. So I would say dryness is more of the common one that I see. So I try to break down their routine with them. That happens way, way more than not. A lot of people come in and they say, my skin's really dry. Here's the routine that I have myself on. We break down every step, what they're doing. A lot of times people will occlude their skin with a lot of different products that have the big buzzwords on them. So something that says it's hydrating or something that says it's a thick moisturizer, and they're using almost too many products sometimes. And again, they're disrupting their skin barrier, making their skin a little bit more oily, which again is going to produce inflammation. So then they get themselves into a little bit of a cycle where their skin's actually getting worse before it's getting better with the abundance of products that they're using. When people are using too many products, usually their skin will get better, taking it more to a basic routine versus doing 10 different steps as opposed to just cleansing and moisturizing. Dry skin patients, so bringing it back down to baseline is the first step. So making sure they're cleansing every morning and night, or say their skin is too sensitive to cleanse both times, maybe they just use a gentle cleanser and they cleanse only at night. We kind of develop a plan that works best for everyone. Once they have that down pat, then we can move into like antioxidant support and sunscreen. That's going to be everyone's basic, especially in the summertime. We have a lot of environmental factors that play a role with the changes in humidity. That's where the antioxidant support comes into play, which is like your vitamin C serums. What that does is improves the skin barrier. So if we can't improve the skin barrier, their skin's not going to become hydrated from using more hydrated products. So that's kind of where we start. We'll switch out, make sure they're using a gentle cleanser, make sure they're using some kind of antioxidant support for their barrier health, and then using a good sunscreen. With oily skin patients, it comes down to more of that sebum production control and inflammation. So with them, again, you bring it back down to the baseline, but we might lead more into some exfoliating products, something with more salicylic acids, glycolic acids, just to get that sebum production under control. And then we focus on their barrier, because once we decrease that sebum production, usually their barrier is a little bit upset still from using lots of other products. So we still have to go back in, give them some antioxidant support, give them some renewal type creams to be able to suppress some of that inflammation. A lot of different factors are just inflammatory to the skin, and inflammation can show up on the skin in a lot of different ways. So inflammation can be redness, dryness, flakiness, but it could also be your skin being oily and shiny, and it could pop up as acne. So a lot of times people come in and just want to treat the acne or the oil or the shininess of their skin, but it really just comes down to that inflammatory component. Combination skin gets a little bit tricky because people try to over exfoliate or they're not exfoliating at all. So with combination skin, you just have to keep a good balanced ground. So making sure they are using non-stripping products, so something gentle for cleansing per se, and then making sure they are exfoliating. So just because your skin is hydrated or not hydrated, it doesn't mean that you should or shouldn't be exfoliating. You just have to adjust what types of levels of exfoliation you're doing to make it work. A lot of times too, with combination skin, you bounce back and forth. So you have to be able to bounce your routine back and forth too and listen to your skin. So sometimes there might be a couple weeks in the summertime where you're exfoliating every single day. There might be some times where your skin barrier is just not going to allow that and you're only exfoliating once or twice a week. For more oily, acne-prone skin, you lean more towards like niacinamides, salicylic acid, retinol to help get that oil production under control. In medical grade products, that presents as either a toner or an exfoliating cleanser. Sometimes there's toner pads or exfoliator scrubs. Those usually have those types of ingredients. For more dry and sensitive skin or skin where your barrier is not quite up to par, you're going to look for products that are a little bit more hydrating and supportive. So something with hyaluronic acid, something with peptides, growth factors, those really help with that kind of issue. Sunscreens is kind of just exactly what you would think it would be. You know, if you do have more dry skin, you could use something a little bit more hydrating, a little bit thicker per se. For more oily or acne prone skin, just keeping something really lightweight will be important. Make sure products don't have comedogenic agents in them, which can clog your pores. With the medical grade products, that's not so much an issue because they're all formulated and regulated. So we're able to know and kind of monitor what ingredients are in some of the products that we personally use here. However, a lot of products over the counter have a lot of pore clogging agents within them. So if you are looking for stuff over the counter, or even when you are looking at medical grade products, just making sure you're seeing that non-comedogenic label on them and just taking a look at the ingredient list and making sure that there's not too many pore clogging agents within it. A lot of just additives, different additives. For example, when you're looking at sunscreens, I always tell patients to look at the labels. You want one with primarily just zinc oxide or titanium dioxide. If they have one or two additives in there, that's okay. Once you start getting to a laundry list of ingredients added on to those two, there's really no need for them. They don't necessarily need to stop the retinol or the retinoid in the summertime. They do have to be more cautious because retinols do increase your sensitivity to the sun. So just a good education component of making sure that they're using a good sunscreen. Diamond glows are a great treatment to do during the summertime. It's a good added form of exfoliation. You can still be out and about in the sun as long as you're wearing sunscreen with it. When you get into treatments like chemical peels and laser treatments, that gets a little bit tricky in the summertime because you do have to stay out of the sun for a week before and a week after, as well as just if you're going to be out and about, making sure you're wearing a hat, making sure you're wearing sunscreen. So it gets a little bit more tricky. All other treatments, Botox, fillers, any injectables, body contouring treatments, those typically are all safe to do in the summertime. Bring it down to the basics, stop everything, start by just adding one thing back at a time, and then making some switches to medical grade products as well. So if patients come in, we bring it back to the basics. I have them just get started on a gentle cleanser. We'll work on their barrier support first, and then we'll slowly start adding things from there. Basics just include cleanser, sunscreen, and then maybe we moisturize as well. There's so many avenues we can go down, whether we're treating pigmentation, we're treating texture, just overall anti-aging. There's different avenues that we'll go down, but bringing it back down to the basics is really where you have to start. Usually at least 4 to 6 weeks. I'll bring them back, they share how it's going, and then we go through again. And now, what are your goals is where we get to next. I have sunspots. Well, how can we target the sunspots in the summertime? That's where we're going to add in maybe some antioxidant support. Those antioxidants like vitamin C are going to help even out the pigmentation. Also, maybe we're working on anti-aging. Maybe we add on a retinol as well. That retinol, we make sure we're also exfoliating because once we're increasing cell turnover with the retinol, those dead skin cells tend to sit on their skin. So making sure that they're also getting something like the Diamond Glow facial or they're using some kind of exfoliation will help as well. So it's kind of baby steps with how we approach that, and then just keep having them come back, every 3 months, seeing where they're at, seeing where we need to adjust, and then giving them the options to have them adjust at home too. So if their skin does get more sensitive from certain products they're using, such as a retinol or an antioxidant support, they're aware that that's an anticipated reaction, so they know what's coming and they know how to adjust it and change it when it does happen. good gentle cleanser. Apex-wise, the papaya cleanser is a fan favorite for sure. Sunscreen's gonna be your number 2 for sure. Whether medical grade skincare is great, and if they could use that, that would be wonderful, because again, we know our products are just zinc oxide or titanium dioxide, but as long as they're being consistent with the sunscreen, I even tell them 30 plus SPF, and I'm happy with it. We just have to make sure that they're using it. And then from there, really just some kind of barrier support. So for some people, that might just be a moisturizer or hyaluronic acid if their skin's more dry, or if their skin is a little bit more acne prone or oil prone, maybe that looks like an antioxidant serum.